the reasons that people with endometriosis often have pain with you know what is because of something called neuroproliferation. We know that people who have endometriosis put out something called nerve growth factor, and what can happen is that we can get an increase in growth of pain neurons at the vaginal entrance as well as in other areas throughout the pelvis and the abdomen, which makes them more sensitive to pain signals and more likely to get pain signals even from touch and pressure that should not ideally be painful. This leads to something called vestibulodynia, which is where people have pain around the vaginal entrance, usually like a burning, stinging type of pain. But people with endometriosis can also have deeper pain with intercourse, which is usually going to involve more pain with deep pressure, usually more in the abdomen. It might feel more crampy, might have pain with pressure to the cervix, things like that. Now, this often also causes a bit of a vicious cycle because when people have pain with activities like that, their pelvic floor muscles are also going to tense up because we have what's called the fear-pain cycle, and we're going to guard against painful experiences. And when people have a lot of tension and tightness in their pelvic floor, it's going to also irritate some of those pain nerves and just make it less comfortable to have something be inserted in there. This then can create more pain, which contributes to the snowball effect of having more pain with that activity. Now, these types of sequelae or issues that come because of endometriosis but are not necessarily directly from the endometriosis, sometimes these things linger even after someone has had endometriosis excision surgery, which is why for a lot of people with endometriosis, pelvic health physical therapy can be really helpful both before and after surgery to help deal with some of these secondary issues.